It is really important because remember, it is waterproof, so you want the tape to stay for a few days. So you will do everything that it takes. It is important to cut off these sharp edges and corners. Yeah, so that no corners, so it will stay for a longer period of time. So it will now become a rounded edge tape, which will minimize the tape coming out every time. Never mind. Okay? All right. Yeah. So, no, go back. I can see sweat. I can feel sweat. So I need to get some. Okay. Only one thing. Sorry. All right. You can sit, you can lie down, whatever. It's your choice. Okay. Again, the same thing. We will have to get this into dorsiflexion and minimize the inversion, eversion at the subtalar joint. Okay. Just like all other forms of taping, taping has a lot of individuality. I try and follow and teach you what I feel makes more sense to me in terms of reversing the mechanism of injury. Okay, simple. So just like the adhesive taping, what we will do, we will go from the medial malleolus, put this into dorsiflexion, and we will put a anchor first, or the stirrup first. All right? Okay. Now a tricky thing, how to tear this tape. Don't try to do this. You can, no problem, but it takes time. Easy thing is just tear this and rip this apart. That's the easier way to do it. All right? So just tear the tape and rip it. Okay. And remember, just remove the tape only enough for the first anchor. All right? Because this will minimize, even if you touch, you're not touching the glue. Okay? Always we will go from medial side to lateral side because we want to reverse this movement into this movement. All right? Not such a difficult thing. Okay. So again, we will use the bony landmark of medial malleolus as our first anchor point. So just stick it somewhere around here. See, no stretch on this point. All right? No stretch on this point. And once it is nicely stuck, okay, then what you do is you open the tape up, leaving the last 2 inches because this will be required to be stuck at the other end. All right? Now, because this movement, normally our feet tend to fall down all the time. This particular strip of the tape is applied with, if this is 100% tension, I can't pull anymore, see? I reduce it a little bit, 80%. Okay, and keeping that tension on, I just go round, round, round here and lock the tape here. So this part of the tape is without tension, this part of the tape is with 80% tension, and now it's locked. All right? So the remaining tape, I just gently pull the paper out. Just make sure that there are no corrugations or no unnecessary creases or folds. Doesn't really matter, but a good tape job should look neat, clean. Okay, now I'm confident. So we have a tape with no tension, 80% tension. Tendon, stretchable belly. Okay, because this needs to be up most of the time, we put more tension. All right. The second part of the tape is to provide the heel lock. It's the same heel lock that we have learned. Okay. Again, we remove that little part of the tape, and if you can come down a little bit, please. Awesome. And from the lateral malleolus, we stick this part of the tape without any tension. Without any tension. Try and keep the feet up. Yeah, okay. No tension here. Then rip the length of the tape, leaving the other anchor free. It's about 2 inches of tape here without tension. Alright, now keep a finger here so that you lock it. 100%, 50%, just about 50% stretch. Okay, bring the tape down with 50% stretch behind, and remember that behind and below, and once you reach below, just apply the tape without any tension. Okay, he has got some skin breakages here, so just good that the tape has finished before that. Alright, so start from the lateral malleolus, 2 inches, no tension. 100%, 50%. Go back, behind, below, and once you have the last 2 inches left, apply it without tension. Okay, alright. Now, we do the mirror imaging on the other side. We rip off the tape for the first anchor. We now apply it over the lower part of the medial malleolus. I'm trying to put some skin so that this tape has its own adhesion, free of the 2 layers underneath. Okay, simple. This without tension. Now I take off the length of the tape, keeping the last 2 inches. I grip here. Alright, 100%, 50%. You come behind. As you stick, go below, and as the last couple of inches, no tension. And once you're done, remember the glue is activated by heat. So use the same paper. This is the most effective way of activating the glue, because this paper has a soft coating on the other side. You just need a little bit of heat, don't burn it off. Okay. Just a little friction will generate sufficient heat for the adhesive to be activated. Alright, this is a simple way of kinesiotaping the ankle, and it's logical also. We put the first strip to promote dorsiflexion, and we put 2 strips as heel locks to prevent the movements at the subtalar joint, which is the movements of inversion and eversion. It makes perfect sense. Alright. Okay. Now here, rip it from the center, take at the ends. Remember, the distal 1 to 5 centimeters of Achilles tendon is the most commonly injured location of the Achilles tendon. Why? Because of poor blood supply, spiral orientation of fibers. So it's structurally as well as functionally different there. Alright, so we will just reinforce extra strip on the, this is where the insertion is. So one finger is 1 centimeter, so keep your fingers somewhere around here. Okay, we do the same thing again. We will stretch this tape, full stretch, and keep it on the tendon, lock it and leave. Alright, and the remaining, just gently place the tape on the skin. Okay, so this provides that extra protection to the most vulnerable part of the tendon. Alright, see again what happens when it comes back to normal, these corrugations are created beautifully. Okay, yeah, thanks.